This is meant to be a more simplified version of the billing and coding components, and that is looking at the 99 codes. 99213 and 214 are the codes that we most frequently use for our established patients, and you can see here that in order to fulfill a 99213, we have to have at 3 or less history of present illness, 1 review of systems, no past family social history, and at least 6 to 8 of the examination components. And that tells us and simplifies it to what we need to have in order to have a 214. 3 history of present illness, 1 review of systems, 1 past family social history, and greater than 8 on the examination. Now, here's where it becomes complicated, is on a new patient. You can look, if you look over at the 204, there's a lot that needs to be included here, including all 9 of the review of systems. That's going to be difficult to do. So depending on the doctor, the situation, we may end up not billing that as often as we bill in 99203. So the history of present illness, we just need to have 3 of these, as you can see, to be able to bill in 99214. Generally, we want to know what is affected. Well, which eye? Both eyes, one eye, left eye, right eye. How bad is it? How long has it been going on? Are there associated signs and symptoms? Are you getting headaches? That's at least 3, and we ask those questions with most of our patients. So as long as we get at least 3 of these, we'll be moving into the 99214 if we satisfy the other things. Review of systems, well, we're always doing at least 1 when we ask about the eyes of the patient. And as you can see here, review of systems, we have to have at least 1, if not more, for a 99214. So if we ask the patient about any other body part that they have, if they have allergies or any sort of issues neurologically, headaches or eye strain or anything like that, we get more than 1 review of system. Past family and social history, the patient's past experience with this illness. Have you experienced this ever before? Have you ever experienced an injury or a surgery that could have resulted in this? Or asking about the patient's family history, social, occupational, past, and or current activities. We at least need 1 of those for a 99214. And then the examination, we need more than 8. So let's look at these. The bottom ones, orientation, mood, and affect, we got those because we're asking about, we note those on every patient. We almost always check pressure. And then the top from there, 1 through 9, is what we do during a slit lamp or checking visual fields, EOMs on a patient. So most of the time we're getting at least 8 of those. Medical decision making is only something we need to have as part of the complexity when we're dealing with a new patient, because we have to have all of the components for new, whereas we only need 2 of the 3 for an established patient. So low complexity, you can see what needs to go into it, versus moderate complexity. So breaking it back down for the patients that we see most often, you can see how it would break into a 99213 versus a 99214. As long as we ask more than 3 questions about the history of present illness, which I think is important for almost everybody's history, if we ask if they've experienced this before, if we ask about more things than just their eyes, are you experiencing any headaches as a result of this, then we get more than 1 review of system. Their past history with it, or about a family history, and then as long as we do more than 8, or feel that we need to do more than 8, then we would be in a 99214. If we don't, then for most cases we would end up into a 213. But I think generally in our practice, most of the situations are in a 99214.